meet the needs of people of Ontario for healthcare without either A, bankrupting the province, or B, raising taxes sky high?
Thank you very much for the question. We've started that process already to get the most out of it, and I think it starts with working with our healthcare providers. So, for example, when we developed the wait time strategy, that wasn't any politician's desire. That was given as good advice by healthcare providers who said that without a wait time strategy, without knowing where you are, you can't possibly reduce it. And what gets measured gets done. So we developed a wait time strategy under the good guidance of Dr. Alan Hudson. And locally, for example, the cataract strategy is led by Dr. Duker. And so we've got a strategy that is working in the key areas. The times are coming down. It's all publicly accountable, so everybody can track the wait times. It allows you to invest, to reduce, and now we're going to expand it, as my colleague Deb Matthews said, this very successful strategy to emergency departments, general surgery, and children's surgery. A way of developing a system and then moving on from there. The lens for another way to make sure you get the most out of the healthcare capacity. I mean, rather than a 1,000 different islands of healthcare expertise, let's coordinate and let's leverage the expertise that our healthcare providers have, large or small, to make sure that we can target the necessary healthcare when it's needed by the patient. That's what's required. And we'll make sure that we continually get the good advice of our healthcare providers, or frontline providers, to develop and to improve the system. The notion that all the answers are in an office tower somewhere is simply wrong. I think in making sure we have these much more localized approaches to healthcare, we build on what's been done locally with the hospitals, and the regional approach that you have developed locally for hospitals in the Southwest region. We're bringing in other healthcare providers. Thanks, Mr. Bentley. We're going to continue on there. Thank you.
As the questioner said, we have an aging population. That's a population that will cease to work at least as many hours as it currently does. And the number of people behind them is quite small in comparison. So we are going to have decreasing revenues at the same time as we have increasing demands on our healthcare system. To suggest that perhaps we could just keep raising taxes is simply not possible. There isn't enough money being earned in the province, especially with the Liberals having 175,000 jobs chased out of the province in places like China and India. To simply raise taxes and have everything, all the problems disappear. There have to be other approaches. One of the things you can do when you're faced with a cash crunch is not simply raise the revenues, but decrease the costs. And one of the proposals we put forward in the Freedom Party platform is that the government can create new avenues of accreditation for foreign trained doctors, for nurses, for paramedicals, each of whom are competent within their sphere of expertise to do a lot of the things that are currently being done by overtaxed doctors. We say take these lesser jobs, these more easily done jobs, away from the doctors. Let the nurses, let the foreign trained doctors, let the paramedicals do things like give your child 6 stitches when he falls off a skateboard. There's no reason to have a position on that. By creating new levels of accreditation, people in the public can see that, okay, this person has the qualifications to do these kinds of things. And we could then take people out of taxi cabs and put them into clinics, hospitals, offices, where they belong. More people providing services means lower costs, and that's exactly what we're going to need as the population ages and taxes decrease in volume. Thank you.
Paul, you mentioned in your intro a sad story about your brother, ER in St. Michael's in Toronto, was it? I'm not really too familiar with this hospital. Do you think it was, this problem with the wait times, I guess almost dying waiting? Was this due to maybe the size of the hospital, is it like a tiny hospital, or is this because of the lack of doctors or the lack of operating rooms because of the size of the hospital?
No, the hospital is actually quite large. There are quite a number of rooms. There's all kinds of bricks and mortar. There's no shortage of space. There's simply an unwillingness to pay anybody to do work on patients. patients. There's a budget, and the government won't go beyond that. Doctors are literally doing whatever amount of time they're allowed to work for, and then going and playing golf, because they don't get paid beyond the number of hours for which they get paid. That's true. The government is limiting the amount of money that is spent on doctors, therefore limiting the amount of money spent on patients, therefore rationing healthcare. And we can but the fact of the matter is people have died. The Supreme Court of Canada is saying to us, and we can ignore it at our peril. But people are literally dying and suffering needlessly because, as the Supreme Court of Canada says, we are rationing healthcare. Rationing. That is not me. That's the Supreme Court. So, the solution here is not, we've all heard that every single party up here except my own, Freedom Party, will continue to ban private anything. Private is evil. Everything private. Private insurance, private involvement. They're only in it for the profit. Well, I'll tell you something. If you don't start looking into the possibilities, just examining them, if you don't elect people to the legislature to discuss the possibility that maybe, just maybe, rationing is what's causing the problem, things will not be better than this 4 years from now. Things will be worse. The population will be older. The number of people working will be fewer. The number of high-paying jobs will be fewer. And we'll be hearing more promises about, we will do this, we're going to do that, we're going to do that. Well, how come it isn't done yet, Ms. Matthews? I've heard lots of promises, and from Mr. Bentley, I want it done, not going to do.
Thank you very much.